Okay, so the thing that I left you with last week was to write down two things. Hopefully you know what they are and you wrote them down. If you didn't, we're going to review, because it's going to be very important to what we talk about with these bioidentical hormones. So I ask you to write down that estrogen equals growth and progesterone equals development. So that's going to be key in what we're going to talk about today when we cover the hormone cycle for women. Is what we're going to talk about today. But I wanted to start with the package insert for a drug that the drug companies teach the doctors, the pharmacists, the physician's assistants, the nurse practitioners, that this is the drug that should be used for women's hormone issues. So I just want to read from their literature, the drug company's literature. It says, what are the possible side effects of this drug? Heart attack, strokes, blood clots, dementia, breast cancer, cancer of the lining of the uterus, cancer of the womb, cancer of the ovary, high blood pressure, high blood sugar, gallbladder disease, liver problems, enlargement of benign tumors of the uterus, fibroids, new breast lumps, unusual vaginal bleeding, changes in vision or speech, sudden new severe headaches, severe pains in your chest or legs with or without shortness of breath, weakness and fatigue, swollen lips, swollen tongue, swollen face, headaches, breast pain, irregular vaginal bleeding, spotting, stomach, abdominal cramps and bloating, nausea and vomiting, hair loss, fluid retention, vaginal yeast infection. And after all that, they say, these are not all the possible side effects of Premarin. For more information, ask your healthcare provider or pharmacist about advice about side effects. So, I want you to think for a minute. They are telling you, ladies, that this is the drug of choice for your menopause, perimenopause, PMS, all these different situations, with that list of side effects. And then they say, hey, there's more side effects, ask your doctor or your pharmacist. It's mind-blowing to me that that's what we're doing. That drug is Premarin. Premarin is an estrogen is an estrogen combination of estrogens from pregnant mare's urine, from pregnant horse urine. So there's no wonder that there's a myriad of side effects from that, right? Because women don't have Mr. Ed in their family typically, and they don't need horse hormones. So that drug, unfortunately, is what they're taught. And this is really sad because balancing hormones can have such a major effect. As we talked about last week, it affects every, function, all the functions in the body, and it is our messengers to our body. So we're going to talk a little bit today in more detail about women's hormones and how this works and why it's going to be so important to understand estrogen equals growth, progesterone equals development, and that the drug companies have confused or they've blurred the teaching on what they say is progesterone and what they put out as progesterone. Two totally opposite things. So the drug companies put out progestins, which they teach is progesterone, which they're complete opposites. So think about estrogen equals growth, progesterone equals development, and let's real quick go through like how a woman's natural cycle would work. This would be childbearing age ladies, of course, and they would have a rise in estrogen the first half of the cycle, or the first 12 to 14 days of the cycle. And then the estrogen will start to decline in about days 12 to 14, somewhere in there. Progesterone starts to climb. And so the second half of the cycle has more progesterone, the first half of the cycle has more estrogen. If the egg is not fertilized, both hormones drop, and that causes the period. Day one of the period, or day one of the cycle, would be the first day of bleeding, and then that cycle would start again. So the typical cycle should be about 28 days. So estrogen the first half, higher progesterone the second half, egg not fertilized, both hormones start to drop off, and the woman then has the natural uterine shedding that we call the period. So here's the thing that is so important to understand. When women have more bleeding or really heavy bleeding, or the PMS symptoms, the nausea, the bloating, the pain, the headaches, all those kind of things where they just don't feel good, the depression, the anxiety, all the things that we think of when we think of PMS, that is typically an imbalance in estrogen and progesterone. And what happens is most women that I speak with today, certainly over the age of 30, I would tell you that maybe 10 or 15 years ago it used to be more like 40, and now it's become lower and lower. It's more like 30. They have what we call estrogen dominance. In other words, their estrogen levels are higher or out of balance, and their progesterone levels are lower. So that is estrogen dominant. There's a lot more estrogen than there is progesterone. And remember that estrogen causes growth, progesterone causes development. So progesterone is the timekeeper of the cycle. Progesterone is the hormone responsible for the baby being viable. It is the progestation hormone. That's why it's called progesterone. And while I'm on that, just to prove to you that the drug company's version of what they call progesterone, that is a progestin, is what we use, it's what they use, to prevent pregnancy. So how can they teach, and how can even a lot of so-called hormone expert in the medical field believe that they're the same thing? If one is responsible for maintaining a pregnancy and one is responsible for preventing or ending a pregnancy, then I'm not sure how we can say they're equivalent. But unfortunately, that's what happens. And I'm going to tell you this is rampant because I teach a course at a pharmacy school, 5th year pharmacy students, last year pharmacy students, and I promise you they don't know this. They've never heard it. They don't know what I'm talking about. I had to revamp the whole course on this because I went in with the assumption they were going to know the basics, and they didn't. And so I had to just start with really basic stuff like what we're doing now. Progesterone is not the same as what they've taught you progesterone is. And so I have to go through that. My daughter is in PA school and just about to graduate. And during her hormone lectures, they had this hormone expert, and I'm going to use quotation marks for that, come in and do the lectures on the hormones. And my daughter has grown up, obviously, with my wife and I being clinical compounding pharmacists, and she has worked in the pharmacies and worked in the compounding lab and heard from the women who've had these tremendous results from these hormones, bioidentical hormones. And so she raised her hand and said, hey, what about, we hadn't talked any about bioidentical hormones in any of these classes. And the answer was to these 64 physician's assistant students was, oh, bioidentical hormones don't have any studies and they don't work. And that was the end of the discussion. So that's what they're being taught a lot of times, or I would say the vast majority of the time, in medical school, in physician assistant school, in nurse practitioner school, in pharmacy school, and nursing school. So there's a really big misunderstanding. So estrogen should be higher the first half of the cycle, progesterone's higher the second half of the cycle. Eggs not fertilized, they drop off. You have the normal bleeding. Hopefully it's not painful, it's not too heavy, but it is necessary, because when women do not have that cycle and they're of that childbearing age, the estrogen levels will continue to climb as progesterone levels decline. And what that does is estrogen causes more growth, okay? So I want you to think about conditions like endometriosis, that is overgrowth, right? That is, think of fibroid tumors, that is overgrowth. Think of fibrocystic breast, that's overgrowth. Think of lots of cancers, that's overgrowth. So It's not to say that estrogen is bad, it's to say that estrogen is a growth hormone. And progesterone is the hormone that offsets the negative type effects that estrogen can have. So naturally, they would be in balance. But what happens is, as women are exposed to more and more estrogen compounds today than ever in history before. And it's not just their natural made estrogen. There's lots of what's called man-made or xenoestrogens in our environment today. It's everything from fire retardants on your mattress to your pillows to your, coating on carpets, on furnitures, car seats. Receipt papers have estrogens, like estrogen mimicking compounds in them. Pesticides and herbicides on foods mimic estrogen. I mean, there's so many different things. We're bombarded, men and women, with more estrogen than we ever have been before. And as women, estrogen is continually made in the body, and the more fat that we carry, men and women, the more estrogen compound is made from our own fat. So as women get past childbearing age, and again, I used to would have said 40 was closer to where I start seeing these issues. Now it's more like 30s. They start to have these signs and symptoms of estrogen dominance. They start to bleed heavier. They start to bleed more time, 2, 3, 4 times a month, or they bleed 10 or 12 days a month. I've had ladies that have bled 60, 70, 80 days in a row. They're anemic, they have all these issues. And what do they usually want to do? They want to give them more estrogen, and those progestins are anti-progesterone. And that's really not the answer. And it's really not that hard to correct these issues. So endometriosis usually ends up in a birth control pill or something like that, and then they eventually have to have surgery. All these conditions lead to depression and different things, weight gain, because estrogen is a growth hormone. And so when we have these imbalances, we have the heavy periods, the PMSs, the nauseas, the migraines, all those things. And then we end up a lot of times with an antidepressant for that, and then surgery. And it's really sad because in the vast majority of cases, women do not need an ablation to burn off their uterine lining. They need bioidentical progesterone. They do not need surgery for endometriosis. They need bioidentical progesterone. They do not need to have fibrocystic breast surgery. They need bioidentical progesterone because it offsets, it develops that growth. So I hope that I'm getting across to you how important having balanced, all your hormones balanced. But for women, the major ones that we think about when I'm doing all these consultations with these ladies, these one-on-ones, is they're estrogen dominant. They have high estrogen and low progesterone. And their bodies will make estrogen their entire life, even beyond childbearing age. Their bodies will not be very efficient at all at making progesterone, especially before childbearing age and after childbearing age. And that's another issue we have today, is younger and younger girls are starting to have their periods, their cycles, because they're exposed to so much estrogen. There's growth hormone in the foods. There's growth hormone given to the dairy animals and stuff. And so it's just everywhere, like we talked about. Then it's in the herbicides and pesticides mimic estrogen. So a lot of these things then lead to a condition called PCOS, polycystic ovarian syndrome. That is where women have high estrogen or estrogen dominance, low progesterone, but with the addition now of insulin resistance. So their bodies are trying to make more insulin to take care of blood sugars, but their body doesn't recognize it. So insulin is a very important hormone that is never tested, in my experience, unless people do my OptiU blood panel. So PCOS is a condition of all the things we've talked about, but now they have insulin resistance and they gain more weight. And that often will lead, this insulin resistance, this high estrogen, will then lead to high androgens or high testosterone. And the high testosterone will lead these ladies, then they'll have facial hair that they don't want, they'll be more irritable. It just, again, a myriad of issues, and PCOS is completely, it's everywhere today. I see it in younger and younger women. So what we have to think of there is the first thing we need to do is balance their progesterone with bioidentical progesterone. Have the discussions that we've been having about eating real foods, getting good sleep, walking, or movement every day, drinking plenty of good quality water from a medical device that's alkalinized. So all these things play a role in that. So PCOS, again, would typically be treated with drugs like metformin for the insulin resistance, more estrogen, and a progestin, an anti-progesterone for the hormonal symptoms, the bleeding and stuff. And it's really the wrong approach, because these ladies will end up with typically surgeries or become full-blown diabetics. So what we need to do is think about ways to naturally mimic what God intended and help put back good natural bioidentical hormones. One of the cool things about it is when we do that, we see that ladies will go, well, gosh, that was so easy, and I feel so much better. And usually they feel better within the first few days. So we just need to start to think outside the box, ladies, of what the medical community is telling us, and look at how the body really works. And it's really not that complicated if we can get you to understand that estrogen equals growth, progesterone equals development, and all these conditions of heavy bleeding, excess bleeding, PMS, nausea, headaches, endometriosis, fibroids, fibrocystic breast, those are all overgrowth symptoms. So that means progesterone is too low. We rise that progesterone level with bioidentical progesterone. By the way, most women who are having trouble getting pregnant or infertile, they have low progesterone. Because remember, the egg fertilized can't survive without adequate progesterone. Most miscarriages are low progesterone. So one of the things we do for ladies to help them with their fertility, to help them maintain pregnancy, is bioidentical progesterone suppositories. So lots of times, women will spend thousands, tens of thousands of dollars with fertility clinics, and they'll be told that they have a luteal phase defect. And the definition of that is low progesterone levels. So we can simply use bioidentical progesterone suppositories in a lot of cases. Let the lady use that for 3 to 6 months, see what happens, and voila, a lot of them will end up pregnant with no issues. We'll use the suppositories through the first 3 to 5 months of the pregnancy, and then the placenta will take over. After the first 12 to 14 weeks, the first trimester, the placenta will take over and start making progesterone. And ladies produce a ton of progesterone when they're pregnant, and the more children that women carry and deliver, the lower their lifetime rates of cancer. And that's because higher progesterone levels for longer term times. So it has so many benefits. It's anti-cancer, it's anti-heart attack, it's anti-stroke, it's anti-blood clot. It's great for burning fat. It's a hormone that suppresses insulin. It's the hormone that builds the myelin sheath around the nerves. So diabetic neuropathy is a damage of the myelin sheath. MS is a damage of the myelin sheath. There's over 300 progesterone receptors in the body. The levels of progesterone are higher in the brain than anywhere else, so it's great for brain fog. It's great for prevention of Alzheimer's and dementia. There's just really no downside to using bioidentical progesterone. Now, it does take a prescription, so you do have to have a provider prescribe it. You do need to get it compounded in a compounded pharmacy that does it with the highest quality ingredients and doesn't use the toxic ingredients and the bases like can be commonly found. So make sure you tune in to the live on April the 17th. Nope, that's wrong. It'll be May the something. I don't know the date. I better not say. So we will see you next week, and we're going to talk more about men's hormones.